بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. طلاب المرحلة الرابعة. Our lecture today in community health nursing about mother and child health care. The objectives of this lecture is to define mother and child health care. Also to identify MCH objectives and to explain the importance and types of MCH. We will start with definition. Definition of maternal and child care refers to a package of comprehensive healthcare services which are developed to meet the promotive, curative, rehabilitative needs of pregnant women before, during, and after delivery, and of infants and preschool children from birth to 5 years of age. Mother and child are the most vulnerable groups of the society. Maternal and child population have always been priorities for public health and community health nursing. This population consists of childbearing women, adolescents, infants, and children through adolescence. They are at risk of illness and complication and disparities. The general objectives of MCH are: first is to give expert advice to the couples to plan their families. This point is pre-marriage. Secondly, to identify high-risk cases and give them special attention. Third is to provide health supervision for antenatal mothers and reduce complications. Fourth is to give skilled assistance at time of childbirth and during puerperium. Fifth, to supervise trained DAs and community health workers and volunteers. Sixth is to impart useful knowledge on desirable health practice that mothers should carry out during pregnancy, delivery, and puerperium. Also to encourage the delivery by trained workers in clean and safe environment. 8 is to prevent communicable and non-communicable diseases. And lastly, to educate mothers on improvement of their own and children's health. We should discuss the importance of MCH, which is mother-child healthcare services. This importance because of 2 points. The first point is mother and child considered as one unit. Why one unit? Because first, during pregnancy, baby takes nutrients from mother. Secondly, certain diseases of mother during pregnancy have impact on fetus. Thirdly, after birth, child depends on mother in feeding, protection, love, social development. And fourth, child learn many self-care tasks from mother. This is about the first cause of importance of MCH. Second cause is the mother and child are at a special risk group or the vulnerable group in the community. That is mean they are dependent or weaker group inside the community. Okay? Now we are going to mention the risk factors to pregnant women and infants. There are many risk factors we should discuss. We will start with lifestyle. Lifestyle of pregnant women including smoking, inadequate nutrition, high alcohol consumption, substance abuse, poor prenatal care, environmental toxins, stress, violence, and poor social support. All these regarding the lifestyle of a pregnant woman. Secondly, the socio-demographic factor, which is mean many factors as low maternal age, low educational level of mother, poverty and poor family, and unmarried status. Third factor is medical and gestational history. This include all factors related to the state of gestation, like primigravida, multigestation or multigravida, short inter-pregnancy interval, uterine abnormalities, febrile illness during pregnancy, abortion, genetic factors, gestation-induced hypertension, less than ideal weight, and also lastly diabetes in pregnancy. All these relate to the medical and gestational history of a pregnant woman. Now we are going to classify MCH according to its type. First type is the antenatal care services. رعاية الحوامل أو الرعاية ما قبل الوضع أو ما قبل الولادة. This type of care defined as care provided to pregnant women to help them tide over the period of pregnancy in a successful way and to ensure a healthy pregnancy outcome. الصور يعني شرحنا هذا التايب بالعملي بشكل كافي. The objectives of this type, which is the antenatal one, is first to maintain mother and child well-being. Secondly, to identify the risk factor and apply appropriate early interventions. Third, to identify complications of pregnancy and to treat it. Fourth, to educate pregnant women on pregnancy and childbirth. All these objectives should be achieved in antenatal stage. The steps of antenatal care are a list of type of cares, like examination, mother to record the height, the weight, blood pressure measurement, examining leg edema, examining any sign of anemia, any signs of jaundice, examining the presence of varicosities, examination of a breast about any tumor or lump. Also take care of the nipple to diagnose any deformity. Examine about polyhydramnias or multiple pregnancies. Examine the uterus about anteversion or retroversion of uterus, both of them abnormal position. Observe the height of fundus, the presentation and the position of fetus. All these steps included in antenatal care. Second type of MCH is the intranatal care, which is simply defined as care provided to pregnant women during childbirth, يعني at time of labor. The objectives of this type is thorough asepsis، يعني خلينا نقول التعقيم أو التعقيم الجيد. Secondly, delivery with minimum injury to mother and baby. Thirdly, readiness to deal with complication، لازم نكون مستعدين لكافة المضاعفات أو الكومبليكيشن المفاجئة. Fourth, care and resuscitation of baby and care of cords and eyes. Third type of MCH care is postnatal care, which is also defined as care of mother after delivery 6 weeks period, which is called purpurium، يعني فترة النفاس اللي هي 6 weeks. The objectives of this type of care is to prevent complication in this period، يعني احتمال يصير complication after birth، فنحن لازم نكون مستعدين لهالcomplication. Secondly, to provide care for rapid restoration of mother optimum health، ساعدوا الأم أنه تسترجع صحتها بالوقت سريع وبوقت مناسب. Third, to provide family planning services، نبدأ نهيئ للفاميلي planning in order to achieve spacing between pregnancy and other. Fourth, to check adequacy of breastfeeding، لازم نضمن انه البريست فيدينج تمام، يعني اوكي ماكو any problem بالبريست فيدينج. Fifth, to provide basic health education to mother and family. Always the mother need health education in every stage، تحتاج إلى التوعية والتعليم والإرشاد. Fourth type is the neonatal care. This type of care usually started in first week of life and the most crucial period in life of an infant. مثل ما نعرف the more critical period is the neonatal period. The risk of death is greatest during first 24 to 48 hours after birth، اللي هي most serious, most crucial period. So, our objectives in this type of care is first, maintain or the maintenance of body temperature. كلش مهم نحافظ على درجة حرارة الطفل الحديث الولادة. Secondly, establishment and maintain cardiopulmonary functions، الاهتمام بالcardiopulmonary function heart والlungs. Third, avoidance of infection. We as early step is to avoid any factors that lead to infection. Fourth, establish feeding regime، واللي هو شنو قلنا should be the breastfeeding، اللي هو the best and preferred method of nutrition to this neonate baby. Fifth, early detection and treatment of congenital anomalies. We should examine thorough examination of the baby, full examination to diagnose any congenital anomalies if it is present in order to treat it. This stage includes certain steps like cleaning airway. First of all اعتيادي by suction نعمل cleaning للairway. We should examine the baby or put the neonate on Apgar scoring. والأبجر scoring هو very important score that is include appearance, pulse, grimace reflex, activity of the baby and respiration. طبعا هو ياخذ 10 سكور ونشوف ايش قد يصل البيبي من هذا السكور. care of cord نهتم بال cutting of the umbilical cord. also care of the eyes, care of skin and cleaning the skin, maintenance of body temperature مثل ما ذكرنا, it is very very important. and lastly establishing breastfeeding as soon as possible. We should start breastfeeding. Fifth type is the care of infants and under 5 children. Simply it is care of the baby starting from 1 month of age to the age of 5 years. Okay? The objectives of this type of care is to provide care during acute illness. Well, acute illness, a lot of causes of this illness, like ARI, acute respiratory infection, diarrheal diseases, any type of blood disease, any type of congenital diseases, any type of medical disease. Okay, well, infectious diseases, a lot of in children, but the most one, acute respiratory infection and the diarrheal diseases. Secondly, to provide preventive care like immunization and nutritional surveillance, provide oral rehydration, especially in case of diarrhea, and provide family planning services and health education. Third is to monitor growth by using growth chart. The growth chart is very important chart to monitor weights, monitor the growth and development of the baby by using weight and height, and sometimes using the age, okay, in order to diagnose any deterioration in growth and development. Fourthly, to provide treatment for diarrhea and other infectious diseases. Any infectious diseases مثل ما ذكرنا, it is either appear in form of diarrheal diseases or respiratory diseases and etc. And this is the last one, and thank you for your listening. إن شاء الله نلتقي بالمحاضرة القادمة.